To the Wellness Wave. Thanks for tuning in this morning to ride the wave with us. Please remember, everything we discuss on the show is for informational purposes only and should not be taken as medical advice. My name is Phil George. I'm a clinical biochemist and a certified personal trainer. And I'm here with Ryan Messina, Dr. Ryan Messina, and he's a chiropractor. Thanks for coming on.
Thanks for having me. I'm so honored to be here, man.
Yeah, we were talking. We had some production issues in the beginning, so we were sitting here chatting a lot. So we've already done the interview. It just wasn't recorded.
Yeah.
So one of the things we have in common, I have a radio show, WCRN, Wellness Wave Radio, and that's in Westboro. I have a lot of physicians on, and these are physicians that are in private practice. In other words, we talked a little bit about this. But the medical field has really changed so much. It used to be you're too young for this, the old Marcus Welby thing. They were in private practice, they had a small office, but now everybody, over 80% of all physicians now are employees of the hospital, which means they're on salary. They get somebody from Harvard with an MBA telling them what to do. We've got to do this. They're expected to see 20 to 25 patients a day, and they have a very strict protocol they're supposed to go by. We talked about this. You come in, your cholesterol's high, here's a statin. You got stomach upset, here's a PPI, proton pump inhibitor. They're not looking for the cause. They're not looking for anything else. That's kind of one of the things that we discussed. And we talked too is that Western medicine is great for emergency care. Acute care, you could break your leg, we're the best in the world. And you had come up with some numbers in terms of exactly what's going on in terms of where we place in the world in terms of cost and in terms of outcome. Can you go over that with us?
Yeah, so out of 88 qualifying countries, the United States ranks number 40, with number 1 being the best, right? Not 88 being the best, right? You know, closest to 100 wins. And we spend the most on our health care. We're projected in 2050 on low back pain, chronic low back pain alone, $4.3 trillion. That's our national debt. That's our national debt right there. And we don't have great outcomes. I see patients that are coming in that still have low back pain after surgery. I would think that if I'm having a surgery, it's going to fix my problem. I'm not going to have any pain. I might have, muscle healing to do and strengthening to do, healing pain, but eventually my problem's going to go away. I still have people coming in. I think to myself, why the heck did you have the surgery? Did you try a chiropractor beforehand? Did you try, seeing a physical therapist? Physical therapy is usually a check off the list because that's part of the medical field's protocol. But 9 out of 10 times, it's a no. This is my first time to a chiropractor. Well, I got to be real. I got to be honest with you. We have limitations,
Well, it's the other thing. It's interesting. I read a book called Doctor Under the Knife, and he talked about that. And he had back surgery, and he said he would never have it again because I don't know the numbers, but the amount that are successful are very, very low. It's extremely low.
So about 84% of patients that go in for a low back surgery, 60% of those have to go in for a second surgery because the first surgery didn't take. It didn't work. We fixed the wrong thing, or again, it never addressed the real problem. And out of the other, 26% of patients, they get good outcomes. Maybe half of those fully resolved, never have another issue like the first time they had the pain. They might develop pain on the other side, or another injury. But the outcomes of surgery are not great.
The other one interesting, Steve Kerr, for the Golden State Warriors, played for the Bulls, had surgery, said he'd never have it again in a million years. That's the whole thing. The other thing, I get a lot of questions about surgery. The other one is knee. Nasty surgery, and those don't normally go well either. So I tell all my clients, anybody that'll listen to me, don't have surgery if you can help it. Any way you can put it off. Now they're talking about stem cell therapy for the back and platelet-rich plasma and things like that. The other problem with surgery is anesthesia. And even though you've had the same anesthetic over and over again, you can still have a very bad reaction to it. The other thing, I was talking to Art, the station manager. He's looking into it, whether he's going to have some surgery for his knee, and do you want the anesthesia or basically a pain blocker? And I recommended the pain blocker because it also increases your risk of dementia because you're going out. So there's no free lunch with surgery. So that's you want to avoid the anesthesia as much as possible. But obviously, it's the whole other stuff. There's a possibility of infection, right? Infection, that could happen. Things can go wrong with surgery. I brought my wife in, actually. She's got bone on bone, and we went to see an orthopedic surgeon. And he said to her, quote unquote, anybody that tells you that knee surgery isn't serious is lying to you. He said, it's a big deal. It's a big deal. So, correct me if I'm wrong, but I think what you're looking to do is to prevent the surgery.
Yeah.
Let's see what we can do. Talk a little bit about the imbalances and stuff like that you do.
So, as a chiropractor, my first goal is to analyze the spine. And when we look at the spine from the front, it should be straight up and down. And from the side, we want to see these curves. We talked earlier how number of people were asked if you could redesign the spine, what would you do differently? And everybody said nothing. It's designed perfectly for what we need it for. It acts as a shock absorber, but a misalignment on the nerve can cause inflammation, irritation to the joint. And as a chiropractor, we want to realign the spine, taking pressure off the nerves, keeping pressure off the discs so that we can help prevent degeneration. Now, in my opinion, and I've actually talked about this recently with a few people, is if we think back to ourselves, and I think about this myself, is that if I had low back pain and I was 50 years old and I found a solution, I was getting great results with it, I would be telling everybody my age. I would also be telling everybody way younger than me, because the general consensus is our problems develop over time. Unless you break your leg, it's not an instant issue. So we look at what are the things we're doing every day, standing, sitting, sleeping, moving about the cabin and around the world, and how are our muscles reacting? Muscle tightness is going to affect the bone, the alignment. It's going to affect how you stand, how you walk. Do you have a short leg? Is that affecting it? Do we need to work with something like a heel lift? And these are all things that we're trained to look at and analyze. And then how do we go about balancing that? In the sports medicine field, my little bit of a background there is we need to train not just to strengthen, but we need to stretch. Again, in our conversation earlier about Arnold Schwarzenegger, strength train for 8 to 10 weeks, 2 to 3 weeks of yoga and Pilates. Can you imagine Arnold Schwarzenegger doing yoga or Pilates?
Right. The other thing, talking about the repetition, and I'm sure, I forget I think it's called ergonomics, where they have somebody that looks,
Ergonomic advisor, yeah.
Yeah, they sit there, they look how you lift things up. Obviously, you don't want to be bending. We talked about that. You want to lift with your legs. Interesting study, because I spent most of my life in the hospital, is the number one profession for back problems are nurses. And what I found out over and over again, because my sister's teaches nursing, what I found out over and over again, it's not lifting the patient. What happens is it's the constant strain on the back over and over again. They go to pick up a piece of paper, bingo, Other thing that's bad about that, if you do it on the job, it's workers' comp. If you do it at home, it's not workers' comp anymore. So that's something, you could be out of work for a long period of time. You correct me if I'm wrong, but I think back is the number one reason people miss work.
It's the number one leading cause of disability in America.
Yeah, and also I would say missing work. The other thing, me being a personal trainer, and you have a degree in exercise physiology, right?
Yes.
So we're talking about that stuff. The other thing, and we talked about a guy, his name is Stu McGill. He's one of the top back experts in the world, and he has these very specific, the big three, the bird dog, the plank, side plank. Look that up. You can look that up online. He has these three, and I do that religiously because it keeps kind of everything in place. But the other thing, what I find, and again, I like your opinion on this, is a lot of times it's, let me just pick this up again. So this is, by itself, this isn't going anywhere. You need musculature around this to coat it up. So what happens, if your muscles aren't strong in your core and your back, only thing holding it up is this. All the pressure goes on this. So what I try to get with clients, and I try to get them to do some core training, because most people's core are really, really weak. So by just getting your core strong, all of the muscles that are supporting the spine, if you just do that, we talked about that also before the show.
Yeah, you know, our lifestyles have become more sedentary at work, at home. You know, there's a good population of people still exercising, staying active, but there's still a good portion of people in the world that are not doing anything. And these muscle imbalances can go back to upper cross and lower cross syndromes, where shoulders are coming forward because the pecs are too tight, the upper back, mid back muscles are too weak because we're always on our phones, we're always on our computers. Because we're sitting all the time, our hip flexors get tight, and we're sitting on our butts all day, so our glutes get weak. And all that muscle imbalance affects the pelvis, which affects the low back, which can affect the mid back, and eventually even lead up into the neck and trigger headaches and migraines. And when we look at what we need to do to balance those areas, it's a very specific training routine for each individual patient, because not everybody is the same. There's a basic group of exercises that everybody could do and everybody can benefit from. But for the most part, we need to specialize some things for some people and even how they do it and modify what type of exercise. There's thousands of exercises in the world for us that are good, but not all exercises are good for each person. And helping people to identify that is kind of fun as well.
So you go in and you figure out what the imbalances. Again, us, both being in the exercise physiology space. We talked about guys, we call it ego lifting. They love to lift heavy stuff to impress the girls at the gym. The worst thing to do, because you can wind up doing a lot of damage. But the other thing I notice with guys, they like to train what they call the show muscles, which are the pecs and the buys.
Yep.
So they do a ton of chest exercises. And what happens is this gets overdeveloped, and you want hunching. And then on top of that, they're on the computer. So you see that, it's called kyphosis, right?
Yes.
Kyphosis.
Yeah.
So the hunchback of Notre Dame.
Yeah.
So you're like this all the time, and you're on the computer. So, correct me if I'm wrong, but what you're doing, you're okay, look at the posture. Well, you know what? You got kyphosis. We have to really work on it. I had a guy at the gym, and he definitely had kyphosis, and he's doing all the show exercises, trying to build his chest muscles to impress the girls. And I said to him, I said, man, you got to work your back. You got kyphosis. And I said, you got to do, some people say twice as much back as you do chest. So you got to work in the back. And if you're looking for the show muscles, the other good thing about it is the show muscles will pop because your back's going back. So you're kind of doing the opposite.
So if I had a patient, you're talking about the hunchback, and a patient called me. I remember I was walking in to vote in election a couple elections ago. And the patient calls me and says, I just finished up with my physical, and I had to call you and tell you something. I said, Miss Judy, tell me what's going on. She says, they want to know how I got taller. I said, okay, so what'd you tell them? She says, well, I told them that I have a good balance of diet. I exercise every day. I see my chiropractor every week. And they said they've never seen that. A quarter of an inch. She said, does that mean that my discs, the disc spaces are improving? I said, you could kind of help rehydrate the disc a little bit. At your age, maybe not very as much likely as it is that you're just standing straighter. And between the year from last year and the year that I've been treating you, it's improved because you're doing your exercises every day. You know what exercises to do every day. We're not just going into it blindly looking up on Dr. YouTube some videos and saying, all right, I'll do this, I'll do that. Maybe you can, maybe you can't. Who's going to direct you on how to modify it so you can do it comfortably and to your ability? We have so many limitations.
Right, the other one, I'm going to borrow your spine again.
Yeah, please.
So what I like is inversion tables. So with an inversion table, I use this, I have back problems. So obviously gravity is pulling here. So if you go in an inversion table, you're going upside down. So it opens up, the spaces here. And if you hydrate before it, it plumps up the discs a little bit. And a lot of people with an inversion table, you can, what it'll do, because look at all the spaces here. If you add even an eighth of an inch to each one of these things, you're going to be able to go into the NBA. You know what I mean?
Yeah, you'd hope so. Hope so.
So again, look at the spaces here. And obviously, you want to talk a little about herniated discs?
Yeah, so when we'll kind of just use the low back here, we have 5 lumbar vertebrae. Each one is comprised of joints in the back, joints in the front. The disc space is actually a joint. The cartilage in the middle here is almost like a jelly donut. So the outside is a fibrous ring, the annular fibers, and the inside, the nucleus pulposus, is the jelly. One way that I kind of explain this to patients is if you take all the incidences in your life, right? We can pick one, a fall down the stairs or fall off the sled when you're going down the snow hill. Well, you fall, that's an opportunity for your spine to misalign. Now, every day from that point on, it's like going down to a river and, well, I'm sorry, not the river. We're going to jelly donuts here. So we put a rock or a pebble on a jelly donut every single day that goes by that you don't get that area checked and worked on if needed. Eventually, there's going to be so many rocks on the jelly donut that the jelly's going to come out. I haven't found the technique, Phil, on how to get the jelly back in the donut. Working on it. Usually it just goes on the fingers in the mouth. But we can't get that jelly back. So that jelly can push out and it can affect the nerve root itself, these yellow areas. It can push on the spinal cord here in the middle. And each one can give different symptoms. Could be low back pain. It could be pain in the front of the legs. It could be tingling into the foot and nothing else. And by going through and looking at the posture, the alignment, the muscle imbalances, we can identify, is it your foot, your knee, your ankle, your hip, or your low back? Is it a composition of all the above?
And we talked before, too, about specialists. You've got a heart problem, you see a cardiologist. You've got hormone issues, you see an endocrinologist, gastroenterologist. If you've got bone and spine issues, obviously, for rehab, you're seeing a physical therapist. But basically, what you do is a maintenance to make sure that's the whole point is.
Well, the goal is maintenance. The goal is wellness and maintenance. Once we can get the problem more stabilized, once we do that, we just don't want anything to return as bad as it was. Chances are, are we ever going to be 100% healed? No, we always have these risk factors in life. But there's different techniques in chiropractic to help herniated discs. Injections, steroids start to actually cause ligament laxity, and that can be a trigger of low back pain just as much as the disc issue. And in order to get to the disc, most times they have to put the needle into a ligament, near a ligament. The steroids are going to go around the capsule and around all the soft tissues there to be effective. So, in my opinion, I'd rather try something less invasive. I'm not a very big needle person myself, but I would rather try something that's going to have less risk factors than possible outcomes.
Right, because steroid injections, because I had a lot of problems many years ago, and I remember my orthopedic guy saying, "I only give you so many of these things." So it actually wears away,
Yeah.
the different,
They're
tendons.
limited now as far as how many you can get. So I use lots of one-liners with my patients, and one of them is try anything once, twice if it works, right? If it doesn't work the first time, right, I get asked, should I take ibuprofen, Motrin, Tylenol? I can't tell you to or not to. I can tell you what I would do. If I had something I knew that was going to work, I would take it if I had to in the interim that I can't get checked or adjusted, right? If nothing else is working, but this is going to help to take a little bit of the edge off, maybe I'll do it. If it didn't help the first time, your body doesn't have to build a tolerance to Tylenol. It's not going to work. Don't continue to take it. Don't put your body at risk of other side effects and think, well, I got to take 2 Advil in the morning, 2 at lunch, and 2 at dinner. That's a terrible, terrible life to live. I hate hearing my patients come in and say, this is, I don't want to eat these things like Skittles, but I have to because it helps me get through the day.
Right. The whole point, and I belong to a group called Root Cause Practitioners, is what you're talking about. Let's find out the root. Let's find out what's going on. The other one, we said, I have this on my show. I have it recorded. The knee bones connected to the hip, that kind of stuff.
Uh-huh.
I had a podiatrist on that says, you could have a hip pain. It could be a foot. Mm-hmm. So you're going to be able to diagnose and say, well, you know what? Yeah, you got pain in your hip, but your left leg is a quarter inch shorter. So maybe we got to put a lift in there. Or maybe you've got overdeveloped chest muscles, and we have to work on your back. We have to do this. We have to do that. So you're kind of reminding me like with the car when they do that check engine thing where they put the thing in and tells you what's wrong. So you're kind of doing that.
The diagnostics.
A diagnostic, exactly.
Yeah.
That's what I'm looking for. Diagnostics. So you're able to look at that and say this is the root cause. This is the problem. You don't necessarily have to take the Advil and the Tylenol. Let's fix the problem as opposed to getting drugged up.
Again, lots of stories. I had a patient always come in at the end of the night and wasn't getting any better once a week. Need to be coming in more frequently for a period, and it just wasn't working for his schedule to get in more frequently. And I had to sit down and I had to say to him, I don't know if this is the right place for you to be because we need to do one of two things. We need to increase your frequency and how often we see you to get better results, or we just got to have this relationship where I'm going to fix you for a couple of days, your symptoms are going to come back, and then we're just in that little cycle. And the week before, I had mentioned to him, because you mentioned the heel lift, I said, one of your legs has got to be shorter. It's balancing. I'm doing some leg checks, neurological scans, and it's getting better, but not 100%. Let's put a heel lift in there. And he gets the heel lift right after that appointment the week before. And I'm sitting here, and I'm getting ready to try to, say to him, we should probably separate. Best lesson I ever learned in chiropractic was never how to adjust the patient. It was to know when not to, and if you're not getting the results, where's the answer going to be? Well, he's going through his x-ray report. He goes, well, actually, and I'm like, huh? He goes, I actually have been feeling a little bit better. And I'm like, get the heck out of here. We adjusted you last week. I'm like, he goes, well, ever since I put that heel lift in, and he's like, I feel like I'm walking a little bit easier and better. It's not hurting as much as long. And I'm like, huh, who knew?
I had, again, both of us coming from the sports background. I had a woman I knew. Her daughter was in gymnastics or something. She was in something like that, cheerleading or something, and she did her whole insurance around whether or not the best coverage for chiropractic. Mm-hmm. That she did everything around that.
Yeah.
The lowest copay and things like that. So again, it's the maintenance thing. It's coming in once a month or whatever. So if you find, again, you can pick and choose what kind of insurance you want. And again, in my opinion, it's a lot better than going through surgery, taking medications, taking shots, and things like that. And I don't know how insurance is now, but a lot of time, this is covered by most insurances, isn't it?
A lot of insurances do cover chiropractic. Every policy plan and insurance company has different rules and regulations, and how many visits you get per year, and what you can and can't do. Some say that you can only adjust the spine, you can't adjust ankles, knees, hips, shoulders, TMJ. You can't do any of the muscle balancing stuff that we've been talking about. So that always either has to come as an extended cost on patients. And for our office, we actually have a special plan that we use for our patients to actually kind of relieve some of the cost on that. But they still get that quality of care. In my opinion, insurance is always limited to the rules, regulations, and reimbursements. We don't accept every single insurance company, because every single insurance company doesn't treat us fairly. So for me, it's not a group I want to be part of. We take some of the big ones like Blue Cross, Harvard Pilgrim, Medicare, Mass Advantage, and some other ones there too. But it is something that patients often will come in and say when it's time to renew or enroll in insurance. Do you recommend a particular insurance company that has great chiropractic benefits?
Now, do you, is it like, I know with physical therapy, if you're in physical therapy, you have to show progress. Is it that way with the insurance with chiropractic?
Yeah. I mean, in my opinion, our documentation still is pretty pristine, and, being able to show, is a patient getting better? Is a patient coming in and telling, I had a 32-week pregnant mom come in, start care 2-3 weeks ago. We've been adjusting her, and she's been doing great. She came in and said, I was able to vacuum the other day without any problems. So that goes right in her note. To me, that shows good progress in how she's able to improve in her activities of daily living. So yeah, we got to show progress, especially if we want it to be reimbursed on our end and we want the patient to be covered.
Right. So, so Ryan, how do they reach you?
So to reach us, you can look us up at Imbalance Chiropractic using your fancy little Google machine. You can give us a call at 508-425-3304. You can email me at Ryan Messina at imbalancecw.com. And know that consultations are free. I can talk to you over the phone. I can talk to you in person in my office. And my biggest takeaway is to help patients and people understand we have other options before having to go use surgery, take medications, get poor results in physical therapy, and live healthier lives. And it doesn't just start with us, it starts with your children, your grandchildren, because if we want to decrease costs and effects on our spines and our health, we need to start younger. We need to start these habits sooner than we have symptoms. The best people that get results with chiropractic care are people that have no symptoms. You know why? Because I don't have to see them as often. They're healthier. They function well. They can do everything they want to do, and they grow up that way. They start learning the lifestyle before they get subjected to sitting for 8 hours a day, 10 hours a day. So give me a call, look us up, and I'd love to chat with you.
Okay, thanks for tuning in. We'll see you next week. And we'll have another good guest on next week, too. So tune in next week. One of the most common questions I'm asked as a biochemist and health coach is, what are the best supplements to take? Choosing supplements is a tricky business. Many companies have poor quality control and questionable ingredients. In the past, I had to send clients to several different websites. I am now able to offer one-stop shopping for all the quality brands I recommend with no shipping cost and a lower price in most cases. Just email me, philgeorge@charter.net, for a free consult.